A very warm good afternoon to all those who have gathered here. On behalf of the St. John's Medical College Alumni Association, it is my honor and privilege as the Academic Secretary to welcome you all to the HJ Mehta Memorial Oration. This is the 41st HJ Mehta Memorial Oration, which the Alumni Association has instituted to honor the memory of one of the most illustrious teachers St. John's Medical College ever had. Dr. HJ Mehta built the Department of Anatomy, was one of its pioneering teachers, but whom we lost sadly in 1973 at the very gates of the college. To introduce and to speak about Dr. HJ Mehta and the oration, I would now like to invite Dr. Stephen, Associate Professor in the Department of Anatomy and a student favorite teacher, to please come to the podium.
Thank you, Dr. Nathan. Good afternoon to the dignitaries, delegates for the Diamond Jubilee, faculty members, and students. It's my privilege to present the introduction to the Dr. HJ Mehta Memorial Oration. The Alumni Association organizes the Dr. HJ Mehta Memorial Oration to perpetuate the memory of one of the most illustrious teachers of St. John's Medical College. Dr. Hasmukh Jethalal Mehta was the first professor to join the college when it started the MBBS classes in July 1963. He laid the foundation of the Department of Anatomy at St. John's Medical College, built it up into one of the finest departments of its kind in the country. Born on 6th October 1923 in Saurashtra, Gujarat, he had a brilliant scholastic career, topping his class in MBBS exams of the Bombay University. It is indeed an auspicious coincidence that the Diamond Jubilee of the Medical College coincides with his birth centenary year. He obtained his MSc Anatomy from the Gujarat University and then worked at St.John Hospital of John Carroll University and Case Western Reserve University, Cleveland, Ohio. He had a love of anatomy demonstrated by his devotion to the faculty and students of his department. To improve medical education, he spent a considerable amount of his energies to update teaching methods. Though he was known as a strict disciplinarian, his students loved him and was admired by his staff and colleagues. His knowledge of the subject was immense, and he had an intense interest in keeping abreast of recent advances. He combined this with an insatiable thirst for knowledge of the allied sciences and subjects of general interest. Whether it was the history of medicine, economics, politics, or sociology, Dr. Mehta was constantly exploring better and newer teaching methods. He was an active member of many learned societies that had any bearing on anatomy, human biology, and cytogenetics. He had to his credit many valuable papers based on his diverse research interest. He attended many international and national conferences and presented papers. His research interests included anthropology, genetics, embryology, histochemistry, and anatomy. Dr. Mehta was the principal investigator and co-investigator in many of the projects aided by Indian Council of Medical Research and State Board of Medical Research. Even in those days, he encouraged his staff, students, and technicians to publish papers. He died as a result of tragic accident in August 1973, right at the college gates. That day, the medical fraternity lost an excellent teacher, a man of warm friendship. However, the memory of this dynamic personality, loved by one and all who knew him, is immortal. Thank you.
Thank you, Dr. Stephen, for that wonderful introduction, and also emphasizing on the fact that in this very amazing Diamond Jubilee celebrations of St. John's Medical College, it is also coinciding with the birth centenary of Dr. HJ Mehta. And on this occasion, it is very heartening that we have a stalwart orator today, and to introduce her, like I always say, there's no better person to introduce someone than his or her friend. And therefore, it's my honor to invite another illustrious Johnite alumni, who was the former professor and head of Department of Medicine at CMC Vellore, and later at the Pondicherry Institute of Medical Science, and is currently the consultant at Narovi Hospitals in Vellore, Dr. Kurian Thomas, to do the honors of introducing Dr. Evita Fernandez for the 41st HJ Mehta Memorial Oration.
Ladies and gentlemen, it's my pleasure to introduce Dr. Evita Fernandez to this august audience. She's giving the oration today, and as you remember, we have just had the introduction to Dr. Mehta. We are here to celebrate the life of and the memory of Dr. Mehta, who has been the professor and head of the Department of Anatomy in St. John's Medical College. Some of us have been students of him from that time and remember him very fondly and with awe, because certainly he was one of the greatest that we could understand of the teachers of the day. I'm sure. Sorry, it's going on. I'm sure. I'll just tell it. I'm sure Mehta previously. I'm sure Mehta would be very glad today that one of his students who have excelled in the field of Dr. Mehta would have been very happy, because one of the students who have excelled in the field of a choice is honoring him with the oration, of the day. Dr. Evita is well known. Many of you would have seen her. She's a very proficient presenter. She has had a number of publications and presentations in India and abroad. She has done many wonderful presentations, and she's done a terrific work. She has been in the limelight for the last many years. She has won many awards, both national and international level. And I would say some of them would be, which I don't want to list them all, but some of them would be, certainly you would need to know, is that the Yudhavir Award from the President of India in 2021 for the sacrificial and dedicated work in the field of obstetrics and for the women of India. Next. She also won the Pride of Telangana Award last year in 2023 for providing changing the pattern of obstetrical care in the state of Tamil Nadu, in the state of Telangana. She's a proud alumnus of the batch of 7th batch. She entered the portals of St. John's in 1969 and completed MBBS training in 1973. She obtained a postgraduate degree in obstetrics from Osmania University and went on to get the prestigious fellowship from the Royal College of Obstetrics and Gynecology in 1985. What happened? Soon after 1985, she took on the responsibility of the Fernandez nursing home in Hyderabad. What she is today is, Evita is now the chairperson of the Fernandez Foundation and the managing trustee of their research and educational wing. What happened in Fernandez Hospital from the 2 decades, from 1985 to 2000, is something really worth understanding. The hospital transformed itself from a 40-bed nursing home to 300-bed tertiary level maternity care institution. Also with number of small peripheral centers. There was also a school of nursing and an institution for children with neurological or other deficiencies. This center has become the referral center all across India now. And this was recognized by the National Board as the referral center for postdoctoral fellowship in maternity care. These are all great achievements in itself, and one would be proud of it as a lifetime achievement. At Evita is the greatest satisfaction Evita has got, I understand, is from starting a training center for professional midwives who worked in the peripheral centers of India. And she was instrumental in, along with the other stakeholders, in developing the content and the curriculum for this program. And the government of India, initially it was a small program, started at Hyderabad, then it was taken over by the government of Telangana and subsequently by the government of India to all the peripheral public health hospitals across India. She has trained many hundreds of midwives who are working now in the peripheral centers of India. I had an opportunity to visit her in Hyderabad a few years ago, and some of my own postgraduates are working there. And they were all very clear about her leadership. The greatest thing about her is the leadership quality. She's there hands-on to provide leadership to people who are junior to her, takes on responsibilities for any failure which is inevitable, and shares the benefit and the glory of their work with all the team members. She has developed into a wonderful team of people in Hyderabad who will certainly has the impact on a much longer level and a much greater level. There are many, she belongs to the batch of, this is the batch of 1969. Many of us are here to cheer her success and also her beneficiary for the great activities of Vita Fernandez. If you ask me what is that thing that made her such a successful person, I would say three things. One is she's a very compassionate person. The second is her competence. And the third is a commitment to her objectives. She was always a compassionate person. I remember young Evita on the first year. She was always a compassionate person. I remember young Evita on the first year of her life bringing the children from mentally challenged children from the nearby institution and giving them a tour of our institution itself. She carried on this compassion. It's a God-given gift, and God has given it in plenty to her. And she carried on that to the rest of her life, and therefore that she was able to focus her on the important things that matter to people. Competence, I don't want to elaborate on it. Her oration will be a definite proof of her competence. Finally, I would say about commitment. She has been following her calling. In spite of her problems for herself and in spite of her sacrificial issues that she had to make, she has continued with her, and that is the reason for her success. I would say, as far as the institution is concerned, the founding fathers would have expected a person like this, who would have, and she's an embodiment of such a person. And for young people here, she is a source of light to which somebody can focus and continue to be an example to the younger people of this generation. Ladies and gentlemen, I present to you Evita Fernandez and ask her to take on the podium to give the chairs. A big hand.
Dr. Evita, thank you so much for agreeing for the 41st Dr. HJ Mehta Oration. Everyone has been anxiously waiting to listen to you. The podium, all yours.
Good afternoon, ladies and gentlemen. I'm terribly embarrassed by all that Kurian said, and that's why I was trying to hide my face. Thank you, Kurian. You've been more than generous. Thank you for those kind words. But I'd like to thank the Alumni Association for inviting me to deliver this very prestigious oration. I'm honored, it's a privilege, but I'm humbled. I'm not a teacher, I'm not a researcher, I'm a doer. And I consider it a privilege to be here. Dr. Mehta, we were very, very scared of him. But once we finished anatomy, we understood he was like clay, soft clay inside, compassionate, and then we became friends. The theme for the Diamond Jubilee celebrations is return to your roots and celebrate the new. And what I'm going to do is actually talk about this. In my 22nd year of my professional life, I was riding the crest. I thought I was the best obstetrician in Hyderabad. But I had two light bulb moments that happened almost simultaneously. I had decided to launch an in-house training of nurses in midwifery because with all my work and we had become a referral center and mothers were dying, and I began to read about maternal mortality and realized countries that had professional midwifery as their task force had very, very low maternal mortality figures, and we had no such force in India. And I was tired of knocking on the doors of the government, and at that time we were doing about 5,000 births in a year, and we thought we had enough volume to start as a pilot project. I also discovered at that time, while I entered into midwifery and began to read about it and understand the philosophy, that we doctors had actually become horribly interventional. So I had to do a reflection of all our work and how were we handling pregnancy and childbirth. And I had to go back to my roots and look at the physiology of labor and do a 180-degree turn in my understanding. And we changed childbirth practices in Fernandez. Because once you looked at the evidence, you had to celebrate the new. So today I'd like to share what I've learned over these years by just listening to women's voices. Overview, let's start with just the basic facts on the crisis surrounding childbirth today. Why is birth experience so important? Why is everybody talking about it? And this began in the 2000s. Let's listen to some of the voices of these women, and are we ready to embrace the evidence? Now, any mother in this audience will know that giving birth is the most critical event in your life. It's joyous, it could be blissful, and it has to be celebrated. But this event can impact you depending on how you felt during labor and birth. And we'll talk a little bit about that. And what I discovered through midwifery is birth memories last a lifetime. I'm sure mothers in this room would agree with me. They remember every detail. And what they remember most was how did they feel during that experience? How did we talk to them? How did we respect them? Was there disrespect and abuse? We know we are facing a crisis, and it's not just in India, it's globally. Women are being coerced into accepting treatment options that they're not comfortable about. Neither do they have the courage to disagree with the doctors. One great intervention is our rise in C-sections. And if a woman has been traumatized with her experience, she will suffer what today we call birth trauma and obstetric violence. And I'm going to spend the rest of my talk about birth trauma and obstetric violence. Somewhere in my journey, I forgot that birth is naturally safe for majority of the pregnant population because they are healthy. It's only 25 to 30% of a population that have complications. And it's because we focus on the complications that we obstetricians began to look at every mother as a catastrophe waiting to happen. We brought women from birthing at home into the hospitals because we do believe, and it has happened, we've brought down maternal mortality and newborn mortality. But what we've done, we've also made birth convenient for us. And we forgot to put the mother and the baby at the center of those decisions. I'd love to know how many of you in this audience have had the sheer joy of watching a woman birth completely undisturbed by any healthcare worker. Lovely, health-wise, fit, physically fit, has gone to childbirth classes, empowered with knowledge and confidence, sets into labor spontaneously, no IV lines, no oxytocin, no epidurals. She knows how to handle her pain. She's been told what to do. She's given the freedom to walk, to drink, eat, has a companion of her choice, and births this baby in whatever position she's comfortable in. She's listening to her body. All she has is a professional midwife supporting her quietly. There's nobody else in the room except the midwife and her birth companion of choice. And at the end of it, she's holding her baby skin to skin, quietly enjoying that moment of bonding. No cord cutting. Physiological third stage, placenta comes out by itself. 2 hours later, she gets off the bed, holds her baby, and walks to her room. I never saw that as a student. I never saw that as a PG. I never saw such a beautiful, undisturbed birth in a long while we focused on high-risk mothers. And I think today this is what we are missing. So why is birth experience important? In 2018, WHO says all women have a right to a positive birth experience. And I draw your attention to the contents of what it says. Respect and dignity, birth companion of choice, and all the other things that I've spoken about. So, if a woman has a birth as I've described, or doesn't matter, she may have a forceps, she may have a C-section, it doesn't matter. But what matters to her is, was she supported? Was she involved in decision making? Was the doctor communicative? Did anybody seek her permission before touching her, before examining her, before doing a vaginal examination? Was she asked, is this what you want? Or how do you feel? That is so important. And at the end of it, if she's had a positive birth experience, she steps into motherhood on a positive note. Her self-esteem, her confidence is there. Maternal-infant bonding is established. Lactation is established. And we know if breastfeeding is successful, you're talking about cognitive, emotional development of that baby. So we who have the privilege of serving these women are actually birthing a new humanity. And we've got to get the story right at the beginning. If we don't get birth right, that woman and her baby, well, they're scarred for the rest of their lives. And if a woman who's empowered like this is birthed her baby like this, that's how she feels, exhilarated, thrilled, empowered. How we feel in birth can affect how we feel afterwards. And that trauma, if it remains unspoken, that woman holds it for years. And in 2004, we now have accepted that birth trauma is one of the factors for PTSD. So what does the mother feel? One is helpless. You can be the vice president of a multinational company, but when you're in labor, you are vulnerable. You are in the hands of the people you trust. And if you've had this absolute vision that you are going to birth normally, you're not going to have an episiotomy, you've discussed this, you're not having a cord cut quickly, you'd like your baby skin to skin. But everything goes different for various reasons. It may have been an absolute indication, but communication has been poor. She's helpless. She will trust you, but after the birth, you've got to talk to her about it. Otherwise, she's going to feel terribly traumatized. There's so much fear. Imagine a prima gravida, a 19-year-old, having to birth in positions that she's absolutely exposed. No sheets to cover, no curtains, but a lot of people milling around telling her to push, push. She's in intense pain. She has nobody with her, no companion of her choice, but birthing with strangers with masks. We are mammals, and mammals want to birth in quiet places. Those of us who have cats and dogs, I'm sure, would have realized this. So why is it we want women to birth in a position, bright lights, lots of people around, and a lot of noise? Ladies and gentlemen, can you see where I'm going? I had to reflect on every aspect of our childbirth practice in our birthing rooms. And when a woman feels she's lost control of her birth, of which she is in charge, she owns it, she's traumatized. And the sad thing is, majority of women feel, this is my lot, this is how it happens. So, and if I want to talk about it, who do I speak to? What do I say? Because when I start the conversation with the doctor, and I'm guilty, I've said this, I said, oh, you're so lucky, we didn't do a cesarean. You've got a lovely baby now, aren't you happy? I never stopped to think, how was your experience? I'm only beginning to do that in the last few years. And so women carry this, unless they meet other women and they talk about it, healing doesn't happen. So let's talk about obstetric violence. There are 5 elements in obstetric violence, and I draw your attention to the second and fourth. The second, forcing the woman to give birth in a supine position. Now, I never knew this was not right till in the early 80s when I realized, oh gosh, this is unphysiological. And we then began to have women propped up, and today nobody births on the flat of their back. It's the most inconvenient position, and yet we were trained to do that because we didn't know anything better. But there's enough evidence to say that no woman should birth on the flat of her back, and majority of the women in our postgraduate teaching hospitals of our country birth on the flat of their back. It's obstetric violence. When we alter the natural process by inducing women who don't need induction or doing a cesarean when it's not necessary, it's obstetric violence. So 3 women in Australia were terribly fed up of what was happening. So they created documentaries. It's a 1-hour documentary called Birth Time. And if you can access it, it's worth looking at. We screened it at Fernandez for our midwives, doctors, childbirth educators, and we had a lot of discussion after that. Now, this led to a nationwide survey in Australia by 2 researchers, midwives, Hannah Darlin and Hazel Keedle. And through social media, they set out a questionnaire and asked women, did you experience obstetric violence? And they mentioned what it was. And if you did, can you share your comments? They were hoping they'd get at least 1,000 women who would talk about it. 8,546 women responded. And they only focused on women who birthed in Australia in the last 5 years. And there were so many comments. And when they collated all that they saw, they put 3 themes. Now, we're talking about a high-income country. I felt dehumanized. People did vaginal examinations without even seeking my consent. I felt violated. I begged the doctor not to cut me. An episiotomy is the most common cut we know. Fingers were inserted without consent. I felt powerless. I was coerced. We're talking about a high-income country. And look at this, 1 in 3 women felt they were traumatized and 1 in 10 experienced obstetric violence. Impact on healthcare workers, midwives, when they feel women are being abused, disrespected, not treated with that level of privacy, they suffer PTSD. Medical students, when they see women being beaten, pinched, and treated badly, they don't want to do obstetrics. I don't blame them. So let's go to America, another high-income country. They've had these listening to mothers surveys done at intervals. The last was done in 2018. They looked at women in the state of California. 8% of them said they were abused and spoken to rudely. And I've just chosen 2 comments. My episiotomy was the worst thing that happened to me. And today, it breaks my heart because thanks to the midwifery program, I've had the privilege of walking into many, many public teaching hospitals. And it breaks my heart that our postgraduates today believe that every primary gravida by default needs an episiotomy. And that's a violation of basic human rights and a lack of understanding of normal physiology. And another woman in the US says, I left the hospital with a healthy baby, but I was traumatized because my bonding with my baby was affected. Let's go to Brazil, where you have a very high C-section rate, and in 2 very large private hospitals, women were asked to talk about how they felt about their birth experiences. And they concluded, there were 3 conclusions. We must have women participate in decision-making if we want to change childbirth practices. Sounds obvious, right? But how many of us actually involve women in decision-making in our hospitals? Women's voices, when listened to, can be an important driver of change. And the third, maternity hospitals must ask women what they want, what are their demands during pregnancy, intrapartum, and postnatal. Now let's come to India, and this is what I love. WRA, White Ribbon Alliance, in 2016 set up a campaign. What do women want? And they included 27 districts and 2 union territories, 335,000 women going into public hospitals of our country answered a single question. What do you want? What is the topmost need when you go into a hospital in labor or during childbirth? And what was the objective? They wanted to first focus on what are the needs of women, look at that information and see what is the topmost that we need to improve the quality of care for women and present this to the people who are making decisions. And boy, didn't that work. But let's see what the top demands are. What do they want? Dignity and respect, facility improvement, 35%. Only 2% out of 335 was satisfied. So what are we talking about dignity and respect? No verbal and physical abuse, no discrimination, privacy. A birth companion of my choice, and give me information so I can make an informed choice and respect my choices. We are talking about ordinary women who are attending birth or going to deliver their babies in public hospitals. Now let's look at facility improvement. Clean toilets, give me 1 bed, 1 woman. Clean labor and delivery room. I find it very difficult when I walk into places and find toilets that are locked, key kept safe for staff only, or for doctors only. But the poor woman in labor has to go to a toilet that has no water, that's smelling, or there's water on the floor, and don't forget, she doesn't have footwear, so we don't know if she's walking into urine, amniotic fluid, or a leaking tap. But our toilet is locked. and it's only for us. This campaign of India led into a global campaign. And in Women Deliver Conference in 2019, we had 114 countries involved. 1.2 million women from these countries said what women want. And it's time we listen. What's the impact in our country? This was presented to the government, so respectful maternity care became a top priority for all of us, starting with the government. In 2016, strangely enough, the government said all women in labor should have a birth companion. And I'd love to know how many of us in our own hospitals allow birth companions. No woman should birth alone. It's a violation of her basic human right. 2019, the government introduced Lakshya accreditation program to look at public care facilities and accredit them for their quality of the labor room and operation theatre. And guess what? Respectful maternity care was a quality indicator, which meant you need to have curtains, you need to have privacy, you need to have a clean toilet, you need to have a bed that's clean, and so on. Now, what we know, looking at all this evidence, disrespect and abuse is a global issue. High income, low income, middle income, it doesn't matter. There's growing research, and what is important, it's a violation of human rights. Sadly, and this is what we need to understand, respectful maternity care begins here. It's an attitude. It begins with the security guard getting rid of his danda. It begins with the hospital policy that says, patients take off your footwear, but doctors can walk in with their footwear. It begins with the medical student being told, introduce yourself. It begins with each one of us introducing ourselves, asking the woman, may I examine you? It begins by drawing curtains. It permeates into every aspect, every touch point of that woman during her pregnancy, intrapartum, postpartum, whoever she meets and whoever she encounters, what has she experienced? That is important. Respectful maternity care involves the whole organization. So now we know what women want. Kindness, respect, compassion. Clean facilities. Nobody is asking for granite interiors or anything fancy. We're just asking for information. Tell me what you're going to do with my body and why. Let me have a companion of choice. Give me the freedom to move around and birth in a position that I love or that I want to. And we are talking about the larger population, the pregnant population, who are healthy, who have no complications. So 4 years later, from 2019, the question I think we all need to ask is, are we listening to the voices of the women we are privileged to serve? We know that social impact through centuries has happened where women have got together and fought for rights. Lots of changes have happened, and Rosa Parks is one great woman who led a whole movement of change. And she says, don't be afraid to take that first step, because not trying is as good as failing. So what next? Simple. Let's empower the women we serve with the right knowledge, with evidence-based knowledge. So which means we need to start looking at our own understanding of normal physiology of labor and empower them in the language they understand. Have childbirth classes. We don't need to do it. There's enough people, childbirth educators, mothers who've had bad births or good births become wonderful educators. And get women to be empowered, confident. Discuss birth plans with them. Find out. And This can be done in a public hospital, it can be done in private hospitals. This is basic communication. Offer evidence-based care. Delay cord clamping. Understand how women birth in different positions. Get rid of this archaic fear that women shouldn't eat or drink during labor. Get them to be mobile, because we're talking about gravity, and when women are mobile, gravity works, it helps in the descent of the head. We were taught to give them pethidine, put them in bed, and not let them walk. So we ended up with women as zombies, and we thought that was the way women should birth. Ask women the next day about their birth experience. I tell you, ladies and gentlemen, in the last 11 years, I've been brought down to size by asking women how they felt about their birth experience. And until then, I thought I was an obstetrician who was woman-centered in everything I did. I had a lot more to learn. The Lancet. So now let's look at the evidence. Are we going to embrace it? In 2014, the Lancet brought out a series on midwifery. And what does it say? It's a vital solution to provide high-quality maternal and newborn care in all countries. We're not talking about low and middle income, all countries. Why are we talking about midwifery? Because the heart of midwifery rests on a basic foundation of compassion, respect, competent care. Because a midwife, to be called a midwife, has to go through a rigorous training program after her nursing. It's an 18 months to 2-year rigorous program, and she has to meet global standards, nothing less, because she's accountable for 2 lives. So we're talking about a professional colleague, not a hath ke niche, not an assistant, but a colleague. And the philosophy of midwifery, they believe that pregnancy and birth is normal. They believe that a body that has been nurtured to build that baby or to nurture that baby can birth that baby. And this is how they empower women with the right knowledge, and they practice evidence-based medicine. There are 56 outcomes improved if a country invests in midwifery. I only chose 3, and I focused on the last one: reduced interventions in labor, which includes C-sections. Government of India introduced the guidelines to introduce midwifery in 2018 December, and we were privileged to be involved in this. Now, the next few minutes, 5 minutes, I'm going to show you images from public hospitals of Telangana. And all these pictures were taken with permission of every woman involved in the picture. We were very, very fortunate to be involved. The government of Telangana asked Fernandez to train first 30 nurses in midwifery because our C-sections were going high, and they wanted to bring compassion, respect, kindness into their birthing rooms. And those midwives now are full-fledged, very, very creditable with their clinical work now, and are helping us train more and more midwives. So as a result, over the years, from 2017 to today, we've trained about 300 odd midwives for Telangana and 22 educators. And each educator then trains another 30 nurses. So it cascades. They are distributed in clusters across 49 facilities, all in the districts. So respectful care. And I just love this picture because now no longer these midwives are running antenatal clinics because there's risk categorization of mothers. So the low-risk mothers are seen by midwives, and the complicated mothers are seen by the obstetricians. So there's tremendous partnership. So when you have an antenatal patient care of, 400, you really want the midwives to take care of these women. So no midwife, no patient, no mother stands and gives her history. She sits, there's eye contact, and there's listening ears. While these women are waiting for their antenatal check, The midwives gather them in numbers, take them to a room, teach them about exercises that they can do, so that will improve their chances of having a normal birth. And these mothers just love this information being given. They slip in some things about nutrition and other things. This is one of my favorite pictures. It's taken on a cell phone. And these women are taught how to handle pain of labor. You know, all you got to do is learn to sway during your pains, because there's no pethidine, there's no epidural. You're giving them mobility and vertical position. And it's like, you know, when you changing your pillows, in the pillowcase, you kind of shake your pillow so that pillow goes through. And that's one of the things that we use to relieve pain of labor. And this is another group of women who've been admitted in a district hospital for various reasons, some of them in early labor. So the midwives have gathered them together, preparing them how to handle pain. So we've got gym balls in district hospitals. And this is another one where the husband has been called in, and he's learning how to give a massage to his wife while she's sitting on a gym ball and trying to handle the pain of labor. These are evidence-based options. Evidence-based options. There's enough research to tell you that these non-pharmacological methods of pain work. And this is another favorite picture of mine in Karimnagar District Hospital. But this is a beauty. Here is a woman, and I'm so grateful to her that she allowed us to take this picture. She's completely abandoned herself in her husband's arms. And there's this tremendous picture of tenderness. And this is what both husband and wife should be sharing. It's one of the most life-changing events in their lives. And they're just being supported. And she's going through her labor. And at the end, she had a beautiful normal birth with her husband with her in a district hospital in Telangana, in a public hospital. But the last slide is the best. 16,000 women over the last 3 years and more have been birthed by midwives. And not a single woman birthed in the lithotomy position. This is evidence. This is using evidence in changing childbirth practices. 192 women birthed in the knee-chest position. As an obstetrician, I had no idea that women could birth in these positions. But when I began to understand midwifery and get into it more and more, and when my midwife, who was from the UK, who came to help us train, she said, Evita, that woman is occipital posterior. I'm going to flip her over. I said, what? She said, I'm going to put her in a knee-chest position and I'm going to birth her. I said, are you crazy? Don't be ridiculous. We've never done that. She says, trust me, Evita. Come and watch. And here was this woman in a knee-chest position. Until that time, she's screaming with low back pain. Flips her over, she births in that position, perineum intact. I was blown away. Any wonder that I'm so crazy about promoting midwifery? Just look at that. This is in our public hospitals, ladies and gentlemen, not in, we do this in Fernandez, but I'm not talking about Fernandez today. 16,000 women. And this was the second gravida in Sangareddy District Hospital. She had a beautiful natural birth, and she was so happy that the baby was given to her, because the last time the cord was cut, the baby was taken away, and she had to pay for her baby to be given back to her. She was so happy with this experience, she caught hold of the midwife's hands and began to kiss it and said, with tears rolling down, why are you so kind to me? This is what happens when disrespect and abuse is taken out of the birthing room. This is what women want. India needs 90,000 midwives. And as a foundation, we are committed to at least training 10,000 in the next 10 years. This is our 75th year of existence. And it's been a privilege, because I was aware that I had a head start in life. Not many people inherit a well-running nursing home. And when you are given privileges, they come with responsibilities. And I was extremely fortunate to have colleagues who believed in the philosophy. And that's how, over the years, we've just focused on making pregnancy and childbirth safe. And we don't use the word delivery anymore. Dominoes deliver pizzas. Orators deliver lectures. Letters are delivered by postmen, but women birth. And we believe that 75 years today, we are built for birthing. And I'd like to quote Mary Mongan, who said it, I couldn't say it any better. My dream is that every woman everywhere will know the joy of a truly safe, comfortable, and satisfying birthing for herself and a baby. And I'll add a little caveat to that. My dream for India is that every woman, when she knows she's pregnant, should first see a professional midwife, and only if needed, should see an obstetrician. I won't be around to see that happen, but it will happen one day. And I hope, ladies and gentlemen, I've convinced you about some aspect of listening to women's voices. Thank you.
I think that says it all. The definition of pin drop silence during the oration, mesmerizing and captivating, and really we are speechless for the enormous work that you have done and for this oration. I would like you to request to occupy the chair, and I would like to call Dr. Robert Antony, President of the St. John's Medical College Alumni Association, and Dr. Tony Raj, Dean, St. John's Research Institute and an ex officio member, to felicitate Dr. Evita Fernandez. Request Dr. Priya Pius, Vice President, to hand over a bouquet first as a token. Please sit, please. Before we end, it's our honor also to felicitate